Hi there. Thanks for joining me today. And I'm forever grateful to Sarah Gray and the team at ausEE who continue to support Feeding Tube Awareness Week and to support infants, children, adults, parents, families, grandparents who um, live with feeding tubes as part of their daily life. So, thank you, Sarah, for hosting this week and for asking me to, or giving me the opportunity, I guess, to speak with families and professionals Australia wide and internationally about some research that I undertook regarding parents' experiences of their child's transition from tube to oral feeding during an intensive intervention program. This was part of a bigger project as part of my PhD, but I'd like to talk today about the parents' experiences because parents have so much to offer us, have so much information to give us of their experiences, and it's not an area that has a lot of research within it as yet, but it is growing, which is exciting to see. So bear with me if you can hear some beautiful waves crashing in the background. I am on Ghana country today and acknowledge those who are from Ghana country, pay my respects to the elders past, present and emerging, and extend that respect to any First Nations people who are present today. So it is very calming and I hope it's not too distracting for people. What I would like to share with you is a little bit of my background. I'm Dr. Emily Lively. I'm a speech pathologist and have worked in the area of paediatrics for 25 years. I've worked with children with feeding and mealtime challenges for about 22 of those years, and my passion really lies with supporting tube-fed children and in particular their families to be able to make tube feeding part of family meal times, to take it away or to take away the medical procedure aspects that are part of it, and to really support children where possible and practical to learn to eat and drink orally. I am also a co-founder of Whole Enteral, which is a commercially available homemade blend that was born out of working with children and families and seeing the children thrive when they transition to real food via their tubes, and see them thrive across areas of development, in their demeanour, in their energy, in the parents feeling like they're doing something for their children, and it led to me co-developing this amazing product. I guess from that aspect, I do like to support families holistically, not just looking at oromotor skills as the speech pathologist, but looking at what the impact is on, or what the impact of tube feeding is on the child, on the siblings, on the family, on development, on social and emotional well-being. And I recognise that children with feeding difficulties has taken them months, sometimes years, to get to the place before they seek help. And we know that that's not going to be fixed in one session, it's not going to be fixed in 1 week, but there are absolutely practical, functional things that we can support families with to move forward with tube feeding, with challenging eating, and that it is the responsibility of the whole family to make those changes, not just the child needing to learn. And from that aspect, or from those key foundations, is where my work lies. So after developing and working with families in our intensive tube weaning program for the last 15 years, I guess I wanted to be able to share the outcomes of, in particular, the intensive inpatient program with the broader scope of professionals and families. And that led me into research. I completed my PhD in 2023, and I guess as a result of that, I've used the outcomes to continue to mould and adapt the clinical services that we provide at Lively Eaters. I probably failed to mention in my intro that um, I'm the director of Lively Eaters Feeding Therapy, which is a private allied health multidisciplinary practice that supports children from birth to 18 years with a range of feeding, mealtime, and tube challenges across dietetics, speech pathology, infant mental health, paediatrics. Um, so through this program and my clinical work, we've had some amazing outcomes and research opportunities. And my aim is to be able to continue to disseminate the outcomes of our research to help medical allied health teams, parents, families, carers, to understand the factors which impact a tube-dependent child and their family when they're learning to eat and drink. So we know that tube feeding interferes with natural development of mealtimes and oral skill. We know that it increases parental medical responsibility. A lot of parents tell us that they feel like a medical mum or a medical dad rather than just mum or dad. We know that tube feeding increases parental stress, physical stress, psychological, emotional, their capacity for caregiving, their capacity to parent other children as well within the family is a massive component. We know that tube feeding impacts their parent's identity as a caregiver because a lot of their responsibility becomes plug this syringe in, plunge that, put this pump on, sterilize that giving set, clean up that bit of vomit, whatever it might be. And it takes away from some of those other more nurturing experiences that parents of non-tube fed children experience. And through that, we know that tube feeding can interfere with the parent-child bonding just because there's not the same physical feeding opportunities. There can be, but typically, typically there aren't. As I said, parents become the medical professional to their child. They're exhausted. There's often a lack of typical feeding routines. Sometimes children are being fed, day and night continuously, pumps beeping at all sorts of crazy hours of the early morning. We know that tube feeding impacts a family's ability to go out as a family. Parents have told us they might choose not to go to certain events or take other siblings with the tube-fed child as well because it's just too difficult. And we also know that parents are quite aware of the public perception of them and their child with a physical, visible tube in public. So there is a lot of impact that we know tube feeding has, which was the motivation for this research, is to really learn from the parents what it is like for them when they are weaning their child, to help guide future weaning practices. Where do we need to support differently, so that we can understand the barriers that parents experience. We can understand the factors that really help parents survive and manage this intervention, and so that we can understand their emotional journey to be able to better support them. We know that parents are the ones that need to implement this at home, manage this day in, day out, and be able to carry forward the therapeutic benefits of weaning. So we need to understand what they're going through to be able to support them best. So how was this research conducted? Basically, we looked at, or we approached parents who had been through the Lively Eaters intensive weaning program from 2014 to about 2019, I think, was the cohort of parents that we approached. The program itself includes an assessment phase, intervention prior to and after an intensive 5-night therapeutic phase with speech pathologists, dietitians, OT, paediatrician, nurses, and infant mental health therapist. During that intensive component of hands-on therapy, we really promote the child's oral intake. We reduce tube feed volumes. It's a very individualised, child and family-centred approach. So it occurs in the context of family mealtimes and supports parent and child emotional engagement. It supports behaviour and state regulation for both the parents and the child. It promotes oral motor, oral sensory integration, and we do that in the context of appetite stimulation and helping the child to learn their satiation cues. So parents who had been involved in the intensive weaning program were invited to participate. An independent research assistant recruited and undertook the interviews to remove any potential bias because I had worked with all of these families and children. All of the children had complex medical conditions, including prematurity, extended hospital admissions, tube feeding at or soon after birth. And we used a semi-structured interview process where the questions prompted parents to reflect on their experiences at critical time points within the intervention programs. We had our questions follow the temporal process, the temporal sequence of the weaning process, from tube feeding to decisions regarding weaning, preparation for and commencing the intensive therapeutic component, consolidating those therapeutic goals into the home environment, and their overall experience. So parents were prompted to explain their tube weaning journey with their child and identify key issues from their perspective, which the interviewer used then to guide follow-up questions. Once we had collected all the information from the parents, the research team, including myself, looked at grouping the responses into patterns of shared meaning based on the emotional and the learning journey described by the parents in parenting a tube-fed child, rather than us predetermining codes or groups and then trying to slot the information in where best we thought. And that gave us a much richer, deeper insight into the parents' experiences. So what were the parents' experiences and what did the parents tell us? The information they gave us was themed into, or 7 themes were created, I guess, from the information that they gave us. And you can see them on the diagram in front of you. So what they spoke to us about was parenting a child with medical needs, the uncertainty of what that meant, the additional demands on them, the loss of normal parenting, having to become their child's medical expert, and the physical and emotional demands of parenting a child with medical needs. These are all things that they never envisaged. If they were first-time parents, this was, even more foreign to them than parents who had had healthy children beforehand. Parents spoke to us about the feeling of, is tube feeding forever? The slow progress they could see their children making or not making, realising the lack of oral improvement, feeling like it was just Groundhog Day, same old every day. The lack of options and information that they were given about tube feeding, about tube weaning, and this feeling that my child can do more, but no one's letting them or giving them the opportunity or supporting us to know how to help them do that. And so there was just this feeling like, is this tube just going to be here forever? Then parents spoke to us about, if we wean, how do we do it? There was lack of information presented to parents from their professional teams about, is my child ready to wean? If we do wean, how does that look like? What do we do? Who does it? What approach do you take? What's the philosophy? What are the options? How much do they cost? What are waiting list times? All of this information was information that parents actively sought. It wasn't information that parents were proactively given by the health teams that they were involved with. Trusting someone new. So, because a lot of these children had complex needs, the families had been with their care team since often since the child was born, and actually being able to have the confidence to step away from that team or to seek another opinion was something that they really needed to feel comfortable with, and to hand that trust to another new team who perhaps didn't know their child as well. But it gave them some excitement that there was a new team, a new approach. This was exciting. There was some relief at someone else making decisions. So a lot of parents spoke a lot about decision making around the tube and tube feeding and tube weaning, but becoming part of the Lively Eaters team, they felt a sense of relief that someone else was providing options, and as a team we were making decisions, and that responsibility didn't land solely on them. They also spoke about there were no other options. No one was giving them options. The teams they were working with weren't giving them options. It was just keep doing what you're doing. And that's something that a lot of parents spoke about, this real feeling of this isn't going anywhere, and there's nothing we can do about it. Parents then spoke about their emotional journeys, so the peaks and troughs of emotions at different times, the real highs and the real lows, and the impact that this had on them. You can imagine if we just think about in terms of weaning, sometimes the child would have a great day or a great meal, or they would drink for the first time, and parents would be super excited, and then they wouldn't do it again the next day, and so they'd be deflated again. It's a real emotional roller coaster. What they found useful was the support from a partner. So when one parent was struggling, exhausted, not coping with the mental load of the wean, having their other partner there to take up some of that slack, to take the lead on that day or that meal or whatever it was super important for them. So that again, that teamwork. And parents also spoke about the mental engagement required for weaning, something they hadn't thought about. If they were parents to only a tube-fed child, they weren't used to how frequently children need to eat, how long it takes to do food prep, how long it takes to clean up the mess that's on the floor, and the child who has food all over them. These were things that were quite foreign to them, and they had to shift their mindset from, have I packed a syringe and some sterile water and the pump and the formula, to what texture is appropriate, have I got it at the right temperature, have I got spoons, bibs, wet wipes, all of these other things, and what am I going to cook that they're going to eat. So this was a big mental load that they weren't expecting. Parents spoke about the celebrations and struggles, recognising progress, and recognising the tiny steps of progress is so important in the weaning process, because we know that realistically only a very small percentage of children will go from fully tube fed to fully oral in the space of a week. But it is so important to recognise and celebrate all the tiny steps that the child is now doing that they weren't doing yesterday or the day before or last week, because it's all those little steps that add up to get to the end goal. But we need to celebrate those little steps and recognise them with parents to give them something to hold on to and to keep working on. Families spoke about learning new skills, new routines for siblings as well, how to incorporate that into what was now needed for their tube-fed child who's learning to eat. They spoke a lot about their ongoing fears. They're eating now, but what happens if they stop eating next week? What happens when they become ill? Is this it? Like, are they now oral eaters, or are we going to have to go back to the tube? It was always something that they held on to until they had seen for a few months that, weight was maintaining or going up, health was maintaining, energy was great, and bit by bit they built their confidence that their child's got it. And a big one too was ongoing concerns about nutrition. So as a tube-fed child, as long as the child is absorbing their tube feed, parents were fairly confident that they were receiving adequate nutrition. As with any child, letting them eat what it is that they're going to eat and how much it is that they're going to eat. There were these ongoing and real fears about, are they getting enough protein? What's their dairy intake like? They're not getting 5 serves of vegetables and 1 serve of fruit a day. And learning to, I guess, allow the dietitians to hold that responsibility for them whilst they worked on the mealtime strategies and just allowing their child to regulate their own appetite was something that parents needed to learn to become comfortable with. Parents spoke about what they'd learnt. They'd learnt about their belief in their child's capacity and their child's ability, and that they believed it all along, but perhaps others didn't. They learnt that options for weaning weren't openly discussed. It was something they had to be proactive about. And some parents wished that had they known that this wasn't going to be a proactive discussion brought on by health professionals, that they'd actually brought it up earlier rather than waiting, another year or another 18 months. Parents learned to have confidence in their own opinion, and that to be able to say, yes, I can manage that. No, I can't. I don't think my child would do as well with that option compared with this option, and building on their confidence. And that all relates back to self-determination, confidence, competence, and working within a family-centred model. The parents also spoke about accepting the receipt of relevant help, and that they had a better understanding of tube feeding as well once they'd gone through the weaning process. So there's a lot of information that parents have provided us. So how can we use this info clinically to support families who... Sorry, I accidentally slipped forward on a slide, so I'm not quite sure how this will pick back up, but how can we use this info? The most important thing is that parents must be key team members. And to illustrate the subtleties in the differences in how parents might be part of a team, I've put together this diagram. Team A forms around the child with the parents on the outside of the team. Decisions made by the team might be discussed with the parents. However, the parents' experience is that they're not an integral part of the decision-making process, and they're not really able to exert influence. Team B is a health professional team that is formed based on the individual child's health needs, with the parents joining the team as invited members. So although they're a part of the team, they kind of remain slightly segregated and not equal partners in the decision making, as the health professionals' perspectives are prioritised over the parents. Team C view the child and parents together as the patient, and therefore the team functions to meet both of their needs. Support and advice are provided to both the parent and the child, but the decision making and action is not a collaborative process. Option D, or Team D, represents our view on developing a respectful and trusting foundation for working with families. The child is at the centre of the care process. The professionals and parents are invited onto the team as equal partners from the outset, so that each member holds an equally valued and respected role in the care and decision-making process. And this is what parents have told us as well, that when they are part of who is on their team and part of building that team, rather than here is your team and now you're the parents, we'll ask you your opinion. It's made a real difference to their feelings of empowerment within that team. Sorry, just another little malfunction with the recording. I've just realised too that my camera's not been on for this whole presentation, so my apologies. How else can we use this information that parents have given us? Parents need to be viewed as change agents. Those that are proactive and challenge the status quo were the ones that made change for their child. And through doing so, they built the confidence and experience that when they do ask questions and they do think outside the square, that they were the times that their child progressed the best. We can use the self-determination framework to explain parents moving into the expert role and being change agents for their child. We know that as parents increase their confidence and their competence and their self-determination, when they were supported by a team that facilitated family goals, we saw the same progress in their child. We saw the child's self-determination increase and improve as well. And using the IPFCC, the International Parent and Family Centred Care Model principles, is also a really powerful way to support parents to be those change agents. Those care principles relate to respect, dignity, information sharing, participation, and collaboration. And partnerships between health professionals and families are built on explicit communication and facilitating parents to have an active role in decision making, in making goals that are relevant and practical for their circumstances and their families, and having access to and being able to implement the therapy strategies is what we really see support parents to make change within their child. And it's okay that parents and professionals' goals don't always align. That is the true nature of working as a team with parents, rather than professionals being the experts saying this is what has to happen and parents not feeling like they have the capacity to do that or don't feel that that's relevant to their child at that point. So what we want to do is nurture parent self-determination. We want to seek solutions together, and we want to find the middle ground where professionals support the parent's belief in their child and support the child's self-determination to achieve their best, whilst acknowledging that the professional goals might be X and Y and the parent goal might be Z, but how can we find that middle ground to be able to help support this child move forward? We can also use the information that parents have given us to improve communication regarding tube removal options. So tube exit plans and weaning options were a big thing that parents talked about. Parents felt that tube feeding had just become the normal state for their child. There appeared to be no clear plan for establishing oral eating and drinking. The support by care teams for trialling weaning varied from positive confirmation of readiness to explicit resistance. But that was only often expressed when this discussion was instigated by the family. So the parents in this research clearly expressed their need to better understand tube weaning and to better understand their options. even if it is that the team that they're working with don't have the capacity for whatever reason to offer weaning, they respected and wanted a referral to somewhere that was able to help them. Parents spoke about tube weaning is the first major intervention that they've been responsible for in the care of their child. Up until that point, many of the interventions have been led by health professionals. You need this medication, we need to do this surgery, you need to be having this treatment for X number of days. But as parents became more expert in managing their child and understanding their child and their complex medical care requirements, they acknowledged that this was actually the first intervention that they were responsible for undertaking, for initiating at times. And that brought about many decision-making challenges that they spoke about, being acknowledged what options there are, being given autonomy to make decisions and try things their way, being empowered to do something differently, and having that support facilitated by a family-centred care model. These were things that parents really valued and wanted in terms of communication from their team. So what are the take-home messages from this research? Weaning, initiating and engaging in tube weaning is an emotional process for parents. It's challenging, it's multifactorial, and it's individual to each family, influenced by the parent's experience of parenting their medically complex child up until that point. So no one size fits all. There are many challenges parents experience with decision making and undertaking tube weaning their child. Parents express willingness to trust in a process if they're provided with options, if they're afforded autonomy, if they're empowered, if they're acknowledged, and if relevant support is facilitated within a family-centred care model. Weaning teams have the power to enable collaboration with parents on family-specific therapeutic supports relevant to their child, and that establishing care partnerships will likely maintain parental engagement and achievement of parental goals, even if services are not able to offer the family's choice. This was a big thing parents spoke about, is those parents that maintained a really good working relationship with their care team, because that team valued and respected and supported their decision to look elsewhere for other options when that care team's experience, expertise, abilities were exhausted. In closing, I would really like to thank the families who have entrusted their children and themselves to the care of lively eaters. It is a real privilege and honour to be able to learn from you all and support you all. I'm honoured that you have chosen to be involved in this research. Your honesty, openness and vulnerability will support and guide parents who are yet to begin this unique journey you have been part of. If you would like to read this specific research paper further, the reference is there. I've also just submitted another research paper that looks at guiding principles for tube weaning from a healthcare team perspective, so stay tuned on that one. And if you would like to have any further support or information, I'm more than happy for you to contact me. My contact details are there. We do support children and families in Adelaide, in South Australia, across Australia and also internationally. So we would love to support you if you require further assistance. Thank you once again to ausEE for the amazing work that you do to support people who require feeding tubes and their families and carers. And again, I'm really honoured that I've been able to share this research with you today.